Hi, I'm Andrea Lewis, and this is my presentation on the risks and benefits of an epidural in labor and delivery. And I'm going to get my screen share up. Okay, the risks and benefits of epidural analgesia in labor and delivery. I am Andrea Lewis. I live in Newark, Ohio, and I'm in the midwife track here at Frontier Nursing University. The epidural was introduced in 1938, but did not become popular until 1970. Today, 60% of women receive an epidural in labor. This effective and most commonly used procedure for pain relief can be used in any stage of labor, no matter parity, cervical dilation, or fetal station. Maternal request is all that is needed for placement unless contraindicated. These contraindications are use of blood thinners, low platelet counts, epidural space cannot be located by the anesthesiologist, and labor is moving too fast, so there's not enough time to place one. Current evidence concludes an epidural may prolong the second stage of labor. So there's concern that the adverse effects of prolonging the labor process could lead to other complications, such as an instrumental delivery or cesarean. The intervention of an epidural has been reported to alter normal labor, causing dystocia or difficult labor. According to Grant, normal labor is, quote, the presence of uterine contractions of sufficient intensity, frequency, and duration to bring about demonstrable effacement and dilation of the cervix, end quote. To be well-informed healthcare providers, we need to look at the effects of an epidural on labor by discussing the benefits and risks associated with it. The main benefit of an epidural would be pain relief. Relieving this pain can diminish the woman's anxieties and worries, allowing a positive birth experience for the patient and her support team. An epidural allows the woman to stay awake and alert, and there is no neurological effect, so she will stay an active participant in her labor and delivery. When coping methods have been exhausted, it provides a means to rest, relax, and get focused. If the unfortunate event of a cesarean is required and the epidural has already been placed, the epidural can be used instead of putting the mom to sleep, contributing to a traumatic birth experience and negatively affecting the baby. Risks and disadvantages of an epidural include uncomfortable side effects such as shivering, tinnitus, backache, and difficulty urinating. A drop in blood pressure might happen, which will be treated. She will be put on bed rest, so she will need assistance changing positions, may be unable to feel contractions, making it hard to push, causing need for additional interventions. She could also experience a spinal headache from leaking spinal fluid. A study done by Shumeli found an epidural added an average of 82 minutes to the second stage of labor, causing a higher rate of operative vaginal deliveries. This is Dr. Rallison, an OBGYN, answering the common question of should I receive an epidural?
Epidural anesthesia in childbirth is one of the things, of course, we talk to every woman about, but it is totally, in my opinion, up to them. To me, I liken it to running a marathon. There are people out there who want to run a marathon. They have a strong desire to run a marathon. I think that's great. They should run a marathon. But if you don't want to, don't do it. Epidural anesthesia is the same kind of thing. It's very safe. It's been refined so much that now it really doesn't affect labor much and doesn't affect baby at all. So quite safe. But it's a personal preference. If you have a goal to do natural labor, just like you have a goal to run a marathon, I support you 100%. Go for it. If you do not, and you just want to have a less painful experience, epidural is safe, fine, your choice.
To conclude, an epidural is the most effective and commonly used pain relief intervention in labor and delivery. It is safe and a quick process, and its use is appropriate for laboring women at any stage. Since research does show that an epidural prolongs labor, we need to assess if the benefits outweigh the risks and disadvantages. Health providers need to stay educated on both sides to assist our patients with informed decisions. Thank you for watching my presentation on the risks and benefits of an epidural in labor.